Hello, welcome back to the channel once again. Today is Monday, September the 11th, 2023. I'm your nurse and educator, Tanya J. Ferguson, also known as Nurse T, HFE, Health, Finance, and Education. If you don't know who I am, if you're new to the channel, welcome. If you have already subscribed, I thank you. Continue to share. Hit that like, subscribe button, notification bell, and so you won't miss any of the good quality content that I have coming to you. If you have not subscribed, please do as I just asked you. Today I would like to talk about prison nursing. And I should say more of a correctional nursing. As in my short, I have put, prison taught me. And prison taught me a lot. And let me give you some little insights about correctional nursing. As I've said before, I've been in the healthcare field for about 33 years now, and counting. It is a different type of nursing. I can tell you it's never a dull moment. Some people will say it's not for new nurses, but me personally, excuse me, I'm still a little choked up from that fan, the air conditioning at work when I was working, head of shift, and when I was under the weather. But anyway, back to what I was saying. Correctional nursing is very interesting. It's a different kind of nursing. It's not for everybody. Excuse me. It is what you call, you have to be a certain kind of nurse, I would say, to work in that area. It's not for the faint at heart. And number one, don't go in looking for your boyfriend or your girlfriend. You got to be strong-willed in the mind. I put it to you straight. I don't sugarcoat nothing. I give it to you like a shot of vodka. Because they can talk the pants off you. They have talked the pants off of wardens. And trust me when I tell you, most of your good-looking men, I mean not most, but you'll find good-looking men in correction, nice-looking women in correction. They look just like you and I. But the difference is they have all day to study you. And trust and believe they are studying you. Correction nursing, I really love. I enjoy it. It's not hard. The setting is more or less working in a doctor's office, at a clinic. It's still nursing. You still pass meds. You still have your wound care and things like that, but it's not as intense like you have in long-term care or acute care. It's actually enjoyable type of nursing. You still have your NARC count and stuff like that, and I'll get into that. But correctional nursing is not for the faint of heart. I'll give it to you straight. You better go in with a strong will, prepare to fight sometimes. And if you ever have an inmate, and they normally call inmates, if you ever have an inmate tell you don't come to work the next day, trust it. Trust it. Because it's either something that's happened and it's about to go down, and they have enough respect for you to warn you, don't come the next day. And I'll give you a prime example. I'm jumping a little bit, but I'll give you a prime example. I worked in one facility, correction facility, and was told that Next day was a French fry riot. I can tell you right now, French fries and things that we take for granted out here in the world and society is a commodity, luxury in prison or jail. And there is a difference. The jail is more or less like in the sheriff's office, detention centers, whereas prison is just what it says. It can be federal or state. The jail portion is when they're awaiting trial to find out where they're going to be going. They usually bring them in, we book them, they strip them, they check them, they're assigned a number. It's just like a regular setting. Think of booking as an admission. Think of your med pass. It's not as heavy. Well, I take that back. In correctional nursing, you can pre-pull on a lot of times. They allow that because the med pass is so heavy. I mean, you think the 20, 30 patients we have to get meds to is a lot. Try 200. So it's a constant deal. Think of it like when you're a cashier scanning. So that's why you have a need to pre-pull. Now some don't pre-pull. I have taken advantage and used that pre-pull method, and it helps. A lot of times you're going to be given Tylenol, ibuprofen, OTCs over the counter, and then you have your psych drugs, where you should float all pills in prison. Float and crush, because they will cheek. And cheeking is what you call when they're taking the medication and then supposed to be washed with the water, but instead they're cheeking it. And believe it or not, they're selling it or giving it away. Disgusting. I know. Prison nursing is interesting. You will learn a lot. You will learn how they think. And like I said before, they have all day to sit there and watch you and analyze you. Never give your first name to a prisoner. It's always last name only. Nurse B, Nurse T. If you have a long name they can't pronounce. What else? When prison nursing is you never ever let your guard down. Never forget where you are. You're still amongst criminals. They're nice, believe me. Now they're respectful, but the key point to survive in correctional nursing, be fair and consistent, and keep it all business. And never ever turn your back and let your guard down, because you can be hurt or fatally injured. It has happened. Your goal, and as I always say, whether I'm working correctional, long-term care, hospital, anything, my goal is to get in and get the hell out. Yes. As safely and as possible as I can. Correctional nursing, a lot of nurses have gone there. I was talking about being a new nurse and going there. You can be a new nurse. You can be a new nurse and go to agency. When I first got out of nursing school, I took the main route, as I was told by my instructor, med-surg. Now some people fight against that. Oh, don't do all that med-surg stuff, do all this and do all that. I mean, to each his own. That's your license. But see, I chose to do med-surg because I want that hospital experience. I worked on med-surg oncology. It changed my life. It changed the way I look at life. because one day I was given meds and taking care of a patient. The next week or even the next day, I could be doing post-mortem care on them. Trust and believe, they broke me in real good, but they also trained me well. Those nurses trained me well. And I'll give you another tip. I have this in my new nursing newbies video. They do eat their young. They do eat their young. But you have to have the right mindset when you go into correctional nursing. Because they will talk the panties off you. They will talk the underwear off you. They will have you bringing them cell phones. I met some nurses, they put cell phones in their boobs. They put them in different oral cavities. Yes, I'll be graphic. Vaginal, anal. Up here, if you have large breasts. Now they have it so where they scan, depending on where you're working, they scan the whole body so they can see what you have. You can't wear any kind of jewelry. Most facilities you can't take in any bags unless they're clear. They have to see everything. That's a policy because contraband, and they will usually give you orientation when you go in there to work, and they give you a list of what contraband is. Contraband is anything from a cell phone, chewing gum, medication. Contraband is anything that should not be in the prison because it can be used as a weapon. Some ink pens. You might carry one pen. Anything sharp, forget about it. You can't do any of that. Contraband, I mean, you can get seriously hurt. They can make a weapon out of anything. And how should I put this? I'll probably have a part 2 about correctional nursing. It's a very, very lucrative field. You can make a lot of money. Just anything with nursing is very interesting. Remember, everything in correctional nursing has a book. But you still have to be careful where you work, because some places are so laid back, they don't count. With the nurses, that's why I kind of cut back going to some correctional facilities, because the nurses are lazy. We good. Because when you're in correctional nursing, this is a big one as well. You count everything, especially those sharps. Lancet, insulin needles, 3 ml, which you get IM injections. Of course, you count your narcs. You count everything. And one facility, safe facility I worked for, we had to count the whole pharmacy. Now, mind you, some people did lack when you have a whole pharmacy. I'm talking like the pharmacy you see in a hospital. Yes, because you're in a pill window. And some nurses are, because of the easy access, a lot of nurses divert. When I say divert, when they steal medication, it's easy access. They call it drug diversion. They give the inmates medication sometimes without an order. You might find some nurses to do that. That's when I say be fair and consistent, because it will come back to bite you in the butt. And don't think just because they're in prison they don't know nothing. Let me tell you something. They know more about what's going on in the world than you and I. They know the rules of the state, the policies and the procedures better than you and I. So you better know what you're doing and keep your head on straight. Don't play no fool. Keep your business and keep your license. There have been many instances where nurses have gotten married to inmates. Nurses are always and have lost their license, lost their jobs. Oh, and always remember this. You cannot have any kind of intimate relationship with the inmate, even if it's consensual. Inmates are considered wardens of the state. You will be charged with a felony, and it's called PREA. Look up the word PREA, P-R-E-A. It's prison rape. I forget what it is. I'll have it for you in the description box and in my next video, part 2, on correctional nursing. I just want to give you an insight about that. I did do a short on that, and I do get a lot of questions about prison nursing and on correctional nursing, I should say. That's on the federal level, but that's any correction facility, and for my men as well. It doesn't matter if you're a chaplain, a visitor, volunteer. They have caught and talked them, manipulated them into giving them things from all walks of life, even pastors who come in to minister to them, on Sundays or anytime. Like I said, never let your guard down. Be respectful, because you're also looking at people who will get out. You might see them in the streets or in society, and that's okay. You might get threatened, but you can always let them know you don't threaten as a charge, and they will get charged for that. So they know the rule. And you have to watch out for the COs, also known as correctional officers. A lot of them have relationships with the inmates. That's another thing. Sad but true. And you would think, why in the world would these people fall prey to this? But you have to think, if I'm sitting there in prison and I have nothing else to do, or jail, nothing else to do but look at you, I can tell you exactly what outfit you had on last week, from your head down to your shoes. And in some instances, underwear. Be mindful of what you wear. You do not want to wear anything revealing, and they will not let you come in like that. You're not there to entice, but you have to be very careful, because these men and women have not been into society for a while. So of course hormones are raging. But as I was saying, you do not want to, why would you risk that? Well, if you're having trouble at home and you have had this happen with nurses, they come in, they build rapport with the inmate, and they start talking, and then they might give them a compliment. It's a very manipulative behavior. You can actually find things on YouTube about how documentaries, how inmates have manipulated nurses. Not just nurses, but people in general. Like I say, even up to the tip-top man or woman, the wardens. And that's a felony. And they have lost careers. 25-year careers. So you want to keep your license. You work hard for it. They might give you a compliment. Let them know, I don't fraternize. Fraternize, that's a lingo for nursing. For prison, correctional nursing. You don't fraternize, and they know that. Don't giggle. You know, thank you, sir. Keep it moving. Keep it business. Do what you gotta do. Get in and get out. That's the goal. Don't waste your time. Like I said, don't go in there trying to find your boyfriend, your girlfriend. If you look at some of the medication you're given, you would not want to do that anyway. Capiche? If you can read between the lines, because you have a lot of people who are in there who may have some kind of communicable disease. A lot of them you will find, depending upon where you're working, if you're in GP, which is known as general population, that's where they all are. You might have green, yellow, top, bottom. Some places you have pods where you actually go into the pod and you're always escorted by a CO. Never ever get with an inmate by yourself, because it does not matter. They have cameras, yes, but still, always get escorted. There have been times where I have not been escorted, but I knew. But one facility I worked at, we had radios. And if I hit that orange button, believe, trust and believe, they're going to come running. That's when I worked in a jail. But never ever allow yourself to get cornered or in a room with the inmate by themselves. When you go out to the pods, be respectful, but keep your distance, because they will crowd around you. Always, always watch your back. Always. If they come behind you, just ask them kindly to step away. Just be respectful. And you will find that the inmates inside the prison and the jail are actually more respectful than some of the staff. And they will look out for you. If they know you, and if you will follow up. The key with inmates in correctional nursing is to be consistent. Don't be nasty just because you can. You have some nurses who would just take advantage of the opportunity to be nasty and talk to them any kind of way. Don't do that. Because that could be any of us. That could be our children. Would you want to be treated like that? No. It's a matter of respect. Just because you're outside of the prison, you can be walking inside. You never know who would have to help you. So you don't be disrespectful just because you can. Because inmate can save your life, believe it or not. But you never let your guard down. Never get too comfortable. And just my advice, even with the COs, I don't eat I don't sleep where I eat. Capiche? You don't want everybody knowing your business. And it's just like any facility. It's just a more controlled environment. And you want to always make sure you are corresponding, and you're following the rule, of course, but you're corresponding with those COs behind that booth, because they hit the control doors. And usually you don't open one door unless the other door is closed. I'm not sure if y'all know about the Briley boys. They were the ones that escaped back in 1984. Yeah, I'm telling my age. It's okay. They escaped. Well, mainly prisoners escape, sometimes with the help of staff members. So, like I say, don't get too comfortable. Sometimes staff, nurses, have helped inmates escape because they're married, they're involved, or they get married. Nurses bring them money, phone, food, whatever they ask you to. And I'm skipping a little bit, but if you start bringing them stuff, they're going to use it against you. Because you know what they're going to say. I'll use myself. Nurse T, I got a real bad headache. I need a Tylenol so bad. I said, okay, let me check and see your order. You don't have an order for a Tylenol. I'm going to give it to you this one time. Don't be telling everybody. Big mistake. You give it to them, thank you so much. They're like kids. They're going to go upstairs or down in their pod. Nurse T liked me better than she liked you. Look what she gave me. I got a Tylenol for my headache. Big mistake. They're going to file a grievance against you. You're going to hear it. And then that other person might ask you for one. And you're going to say, no, you don't have an order. Well, you gave so-and-so inmate a Tylenol with no order. Big mistake. Next thing you know, you're going to be bringing that inmate McDonald's. If you have to Uber it to them or whatever, they don't care. They want a cell phone. They want whatever they want, and they better get it. Or either you're going to lose your license or your job, and you're going to serve time. And you're going to have a felony against you, and God knows whatever else. So don't write a check that your booty can't cash. Simple as that. Don't start nothing you can't keep up. Don't ever do that. Because it'll bite you every time. And like I said, it's manipulation. It's control. It's to get what they want. So, if you want to do correction nursing, you can survive. It's good. Like I said, I'm going to have a part 2 to this, because correction nursing involves a lot. It's a lot to learn. It's just like any nursing. You have to always keep your eyes and your ears open. Never ever let your guard down. Don't forget where you are. You might be in a clinic, or it might be, real laid back. Never get too comfortable. Get in, do your work, and get out. Maintain your professionalism, because like I said, they will jack you. And the women, same thing with the men. They'll come in, they'll try women to women. So, it don't matter. They don't care. Whatever it takes. But you want to make sure you CYA at all times. They will document on you. They'll file a grievance against you. Make sure you document. Document like the state's on one side and the attorney's on the other. And they have even gotten some doctors, believe it or not. When I tell you, they will jack you. Another thing I'll give you about correctional nursing is, as far as the sharps, always watch your card. Keep your card locked at all times. You do not want an inmate to get keys. No kind of keys. You always want to, what was I going to say? I forget what I was going to say. Oh, I forgot. It was on the tip of my tongue. I forgot. It'll come to me. If not, I'll put it in part 2. But anyway, I'm not going to hold you much longer. I hope you enjoyed this video. Again, I'm Nurse T from Nursing Education, Educator, HF&E, Health, Finance, and Education. I'm here to bring you quality content. Leave me a like, share, and please subscribe to my channel so I can bring you more quality content. If you have any questions, you may DM me. Please don't video message me. I usually don't answer video messages, but you may also email me. I'm on Instagram as well. You can put your comment in the comment section, and I will respond. because I try to go back and review those comments. I say as far as video messaging through chat, because I don't usually have time, and some people just will have no boundaries. They'll just video call you anytime, you know, and I'm like, who's this? But if I have a appointment with you or something like that on a business level, that's different. If we're doing a mentorship or something like that, that's a different different reason to do that. But I have to know about it. But just out of the blue, no, don't do that. But I hope to see you in the next video. I'll put any information I mentioned down in the description box. And once again, I said, please share this video with your family and your friends. I will be having some giveaways coming up. I have a lot of information, a lot of things I want to share with you all about health, finance, and education. I do have another channel, a website. I teach English online as well, and that's www.soar2english.com. I am in the process of updating that website with different classes coming up for the fall and going into the new year. New nursing information, plenty of nursing videos, nursing courses. So if you have any questions, please feel free to email me by DM, by that website, on Facebook. You can have Ferguson International Ministries. I'll put that link down in the description box as well. I thank you so much for watching and your time, and I love bringing you information, and I have so much more to share with you. So let me know some topics that you would like to hear about. I've been in this field for 33 years, and I am full of information, so I'm here to share with you to help you grow so we can grow together. Until then, wash those hands, be safe, and I will see you in the next video. Bye.